Hello, everybody, and welcome to this week's episode of the Weekly Wealth Podcast. My name is David Chuddick, and I am a certified financial planner with Parallel Financial. And what that means is I help for my clients to make the right financial decisions for them for the reasons that are important to them. So if there's anything that's keeping you up at night with regard to your money, email me, David at parallelfinancial.com. We can have a short conversation, and I am always happy to be a resource and point anybody in the right direction. And don't forget to check out our website, www.weeklywealthpodcast.com, and download our financial basics worksheet. And hopefully that can get you to start off 2022 on the right foot with regard to your money. Today, we're getting off of money a little bit, and we're going to talk health and chronic conditions and just some things that we all can do to manage our health. Because let's face it, we can do all the right money things, but if we have health issues, then is really what's the point? So we have a lot of control over our health. We have Dr. Janika Benoit, better known as Dr. J, on social media. She's a board certified internal medicine physician and a sports medicine specialist, and she's a founder of medfitdo. She's also a runner. I used to be a runner, exercise enthusiast, and a former ACE certified personal trainer. So, hey, Dr. J, how are you?
I'm doing well. Thanks for having me here.
I'm really excited because I love to have a holistic financial planning practice where we talk about every aspect of our clients' lives, because money is super important, but so is health, so is relationships, and so are the parts of our lives that are just we have some control over. So. Well, tell me a little bit about your story. How tell me about your practice and a little bit about your background, because this is pretty interesting to me.
Yeah. So as you stated, I'm a board certified internal medicine physician, sports medicine specialist, and I really got started on this journey since my second year of residency. So I remember one specific day during my second year of residency, I was just finishing up my clinic day, and I was just so ready to be done with the day because I was just feeling so overwhelmed. And as I got on my bed with the covers over my head, I realized that I was feeling just like my patients, because just like my patients who were overwhelmed of being on so many pills, I was feeling overwhelmed and having to constantly prescribe them and refill them. Just like them, who sometimes didn't even know why they were on certain pills, I felt like I didn't know my why as a doctor, because what I really wanted to do is help my patients find health. And I felt that I was just maintaining their health with just prescribing and refilling their pills. And just like my patients who felt like they didn't feel in control of their health, I did not feel in control of the trajectory of my career. I knew that I wanted to do something different. I knew that I wanted to do something more. I knew that I wanted to make impact in a much bigger way on the health of my patients. And I felt like this path was laid out to me, but I was just like, I can't keep on going on this path. I have to kind of, trail off. So in order to do what I want to do. And what I realized is exercise. I've been an avid exerciser really since high school. And it was initially challenging to keep that up during residency. And I would tell myself limiting beliefs like, oh, well, maybe I have to give it up because I'm a resident now and I don't have the time anymore. And I was just like, no, like I'm going to do a little bit on a regular basis. I'm going to do what I can in order to make this a habit, because I want this to be part of my lifestyle. And quite frankly, it places me out of integrity to tell patients that you should eat healthy and exercise if I'm not doing it myself. So in order for me to keep my integrity intact, I'm going to make this a habit and practice what I preach. So, that led me on the journey to then, helping, busy professionals who have chronic illnesses, help them reverse their chronic illnesses so, that they can live lives where they feel energetic, more youthful, and more vibrant again. Because I remember, how I felt in that setting, and I want to be able to, liberate others as well.
So I like to ask dumb questions because I'm not a doctor. Let's talk about what is a chronic illness and what are some of like the common chronic illnesses that you're seeing from 25, 35, 45 and up, kind of stressed out, maybe overworked, under exercising, professionals out, or moms, dads. I mean, we're all busy. So what are some of these chronic illnesses?
Yeah. So, I mean, a chronic illness is an illness that you have for an extended period of time. So, what I mean by that, like 3 months or more. And the common chronic illnesses that I typically see is high blood pressure, diabetes mellitus, high cholesterol, obesity. Those are the common ones. And, usually with these chronic illnesses, they are maintained by being on pills. However, I really wanted to err on the side of prevention because I really don't want patients to come in and having to be on these medications when I know that this can be preventable. So, that's why I also love talking about exercise, because there's actually strong evidence that shows that regular exercise can prevent a lot of risk for cardiovascular disease, such as all the previous diseases that I mentioned: high blood pressure, diabetes, high cholesterol, even certain types of cancers like breast cancer as well. And it can help with depression, anxiety, can help improve sleep quality. So there are all this strong evidence that exists out there that shows that exercise can do this. And there's also a dose response relationship as well. So what that means is that the higher frequency and intensity of your exercise, the lower your risk of developing these chronic illnesses as well. But, we still have to start somewhere to even experience that dose response effect.
So you have someone who is, let's say, 45 years old. Like everybody else, they were probably a high school athlete, thought they were going to go to the pros, never did, but, were in really good shape. And now, they're 20, 30, 40 pounds heavier. They gained a pound or two per year. And now, you have the proverbial dad bod what are some of the things that person who still is a dad, still is a mom, still is running a business, still is in, a job that is demanding, like what can that person do, as far as exercise? Because a lot of people, I think there's the excuse, well, I guess I have to run marathons to get any benefit, but I don't have time to do that. So I just won't do anything. And of course, that's the wrong answer. So what are some exercise types and tips that you have for our listeners?
Yeah, so actually, ironically speaking, I don't even start with exercise in that case, because I start with their mindset. Because for me to tell someone to start exercising, that's me telling you what to do. And likely you have not developed this habit for a while. There's no like eureka that's going to happen just because I told you so, right? So, I like to understand what are their drivers of change, or if there are any drivers to change, because, there are times that we don't even get really deep and think about, okay, what is the purpose of this change, right? What's the emotional and motivational drivers for me to make this change? So a dad, as a parent, you want to be around for your family. You want to see, your little Johnny and Susie, get bigger and graduate from college. So I would also, ask them, okay, like, well, what would motivate you for change? Do you have a why? So it's extremely important to determine what your purpose is, because your purpose for making a behavioral change is what sustains it and make it a long-term behavioral change. Because so often we stop and go, and we don't remain consistent. So it's important to first determine what the person's why is. What is their purpose for making a change in the first place? Have they even considered a change, and why not? And also determining what the limiting beliefs are, because maybe they think, oh well, I can't do push-ups or whatever, and it's just no one said you have to do that. There are so many simple exercises that you can start with, right? So, but if this is a person, so it depends the fitness level of the person, the the fitness experience of the person. So let's say this is a sedentary person, a sedentary dad, I would just start as simple as walking. And the reason I would start so simple is, you know, we as human beings have to feel confident when we're performing a type of movement. This is called self-efficacy. So it's what self-efficacy is that your ability to sustain a behavioral change based on your confidence level, right? So I would start because we walk all the time. That's pretty simple thing to do. And I usually tell my patients 30 for 5. According to the physical activity guidelines, we should do about 150 minutes per week of moderate intensity exercise and 75 minutes per week of vigorous intensity exercise. So I would just, I hit a little bit below the guidelines to get them a quick win, because that quick win is going to help boost their confidence level and also provide them with the belief that, okay, if I can do this, then all right, I can, maybe increase my minutes, or maybe increase my intensity. Maybe I'll start walking with weights in my hands or weights on my ankles or a heavy book bag.
Is more better, or is there like an optimal amount of exercise for me and an optimal amount for you?
Yeah, so it honestly, it depends on your fitness level. Because if this is a sedentary person, I would say just start where you are. Mm-hmm. But if you are, you exercise regularly, then I would say, yeah, definitely there's room to improve. You can definitely increase your intensity, increase your frequency, increase your time. There's definitely room to improve. So
I love it.
It just depends.
Now, talking about mindset, actually, my last episode, I talked with a business coach named Dee Gredler, and she has a tool called the Power of 7 Whys. So, hey, Dr. J, why do you want to exercise today? Well, I don't know, because my doctor told me to. Well, why? Well, because I'll get me off of blood pressure medicine. Okay, well, why? And if you ask that 7 times, it's going to be something much deeper, like I want to be around to see my grandchildren graduate, or something that's much, much more important than the number on the scale, because that number itself doesn't really matter. It's, what's happening inside, or what that better body image does, or how you feel and things like that. So there's always a much, much, much deeper why for anything: money, health, relationships, anything like that. So
yeah, for sure.
So what happens like in my body when I'm exercising that's so good? Like, why is exercise a good thing? Because you always hear, diet and exercise. Well, okay, great. But why? What is so good about exercise?
Yeah, exercise, it releases neurotransmitters such as dopamine and norepinephrine and epinephrine. And these are all neurotransmitters that affect our mood, right? So they're mood enhancers, right? It makes us, that's where we're energized and, and we're happy, we're like ready to go. So, and that's what, people want to feel. They want to feel more energetic and they want to feel more vibrant instead of like sluggish during the day and, feeling heavy. So yeah, that's the physiological effect that exercise has on the body.
I bet I ran a few marathons in my 20s, and I ran one a few years ago. And I remember saying, like, the runner's high, like you almost feel bad for someone that's never experienced it, because it is a real thing. Like you really, sure. you feel that euphoria of, and it's a chemical thing. It's a great thing for sure. So diet and exercise, what are some easy diet tips that like anybody can follow once they get past the why do I want to quote eat better? So somebody's decided what their why is, and they're willing to make those changes. They know that some things are going to be inconvenient, and maybe you're giving up some of fast foods and things that are both disgusting but also taste good kind of in the same bite. Because they're genetically, they're chemically engineered to taste good and probably be addictive. But what are some of your just really generic diet and nutrition tips?
Yeah, so one that I really like is because vegetables can go bad, right? So we buy the vegetables, we put them in the fridge, they go bad, and it's just like, oh well, I had every intention to eat my vegetables, but they went bad.
And if you just leave them in there long enough on purpose so they do rot, then you don't have to eat them, and it's like, oh well, I don't get to eat my vegetables. Wink, wink.
Right. So like for anyone who's, busy, cutting up fresh veggies and then putting them in the fridge, is like a really quick way to get your vegetables in. And then, after that, you can either saute it, um, to make it into a hot meal. Also staying hydrated, right? Because I know like during the day when we're busy, it's hard to it's hard to remain hydrated. So, keeping a water bottle on your desk or what have you. So that's a constant reminder that you drink water. Those are, and also being mindful of, the work treats, the cookies and all that stuff that comes to work. So I also recommend planning. So like meal
Mhm.
planning and bringing your meals to work so that you already have your meal set, that you're not distracted by all the other food that comes into work as well.
So interesting for me, I eat very well at the office because that junk is typically not here. At home, we have kids and there's a little bit of junk. So there's a few more temptations. All right, so let me throw a couple words out at you, and let me hear from you. Are these good? Are they bad? Are they neutral? Or what are your thoughts? So, word number one: vegan. Good, bad, indifferent. Tell me what your thoughts on vegan.
Yeah, I'm indifferent. I'm not really into the specific diets,
Okay.
For me, at least for me, I'm personally speaking, is I pay attention to like what my like body feels and how it responds to certain foods. So me personally, and I recommend other people to be cognizant of how food makes them feel, right? So if meat makes you feel yucky and bloated, then maybe avoid meats for a while. But there is also some evidence that state that meat there are some meats that can cause colon cancers, but I would recommend it in moderation and being cognizant of how food makes you feel, right? Because there are foods that make you feel energy depleted, but there's also foods that make you full of energy. It's usually the healthier proteins and colorful vegetables that give you that energy. It's usually like the carbs, the sodas, the
Mhm.
chips. That is what depletes your energy.
Yeah, I remember, back in the 80s and 90s, there was, low fat, low fat, low fat. Now we're on low carb. Now, but we've never been on a low colorful vegetable. So that's probably the thing that'll, we could probably debate a lot of different things, but colorful leafy vegetables and things that grow from the ground will probably never be considered unhealthy. So, but things like, there's paleo, there's low fat, there's low carb. I mean, is it like some of that might be good for me and not good for you, and vice versa? And it depends how my body works slightly different. Like, do any of these diets or eating styles, I mean, do they have merits, or how should you look? Because it's so hard as a layperson just to know. Like, eggs used to be the worst thing ever. Now eggs are supposedly good for you. I mean, I don't like how does one decipher all of this information?
Yeah, you see, and there are so many different diets, and it gets so
And I can come
confusing.
out with a study to support anything I want it to support, can I? Pretty easily. I mean, if I'm,
Pretty much.
yeah, yeah.
Pretty much. And so that is my distress with all these different diets. But I mean, we know just, there's already so much evidence that shows that, vegetables, so colorful vegetables, you want your food to be colorful with vegetables, and you want it in
But
moderation in between.
Fruit Loops are colorful.
Yeah, but they're also high in high fructose syrup. It's like the first ingredient,
I know.
high fructose syrup.
Uh-huh.
Um, yeah, so what I mean by colorful vegetables, not colorful Fruit Loops.
I'm just trying to make sure everybody knows that we're being clear here, that they have to be
Yeah,
vegetables.
yeah,
They can't be artificial food colorings and
right. And
processed chemicals.
right, exactly. And I think it also, yeah, like I stated before, is just paying attention to the how the food makes you feel. But more often than not, those Fruit Loops, those sodas and fried foods, that's the energy depleting stuff. And once you change your diet and you eat more colorful vegetables, fruits, you will notice a difference in your energy level and how you feel in your mood.
And a little bit more energy. So now you can exercise a little bit more, which means you may drop another pound, which means the whole snowball is working for you. Whereas in the other direction, just one more nasty fast food meal, less energy, you gain a pound. So then you're going to sit and watch more TV because getting off the couch is that much harder. So then you're going to eat more and gain another pound and snowball in the other direction. So I think it all kind of works positively or negatively for us at all times. So another word that you hear a lot about is inflammation. What is that? Why is it bad? What can we do about it?
Yeah, so inflammation is just the body's response to an injury. So the easiest example that I can explain is an ankle sprain, right? You're walking, you walk off a curb and you invert your ankle, or your ankle rolls inward. And then what happens to your ankle? It's swollen, it's hot. Those are all physical manifestations of inflammation, right? So that's just an example.
So that's not a bad thing. I mean, your ankle needs the inflammation in order to heal itself, correct?
Yes, correct,
Okay.
correct. So yes, so there's times where you have the inflammation and it's there for healing, but sometimes the inflammation can be overexerted in the body, and that's when, especially in people who have autoimmune disorders, like for example lupus, that's when inflammation can be really high, and that may be maintained with either nutrition or exercise, and the worst case scenario then steroids.
Okay. Okay. Are there certain foods that uh, promote inflammation as a negative thing, and certain foods that you should eat that would prevent excessive inflammation?
Yeah, I mean, all those processed foods that we spoke about before, those, they can definitely be inflammatory inducing. And it's better to focus on more colorful foods, more colorful fruits, vegetables, whole grains.
Yeah. What's interesting is kind of how health and money mirror each other. There's probably, I don't know, 5 or 10 things that if you either do or don't do with your money, you're pretty much going to be okay. Don't spend excessively, don't live beyond your means, build your value so that you can earn more money and those kind of things. And you're going to be okay. Well, it's probably in the physical body, there's probably, I mean, because you've mentioned the vegetables, the colorful vegetables several times, and it seems like that is kind of the answer to quite a few health questions and health problems.
Oh yeah, no, for sure. And and that's the thing, right? Because even with money and health, there's like all these distracting things. Oh, should you be paleo or vegan or a pescatarian? There's just so many distractions, and I'm sure it's the same thing in your field, right?
Uh-huh.
But if we just go back and just stick to the basics, just the basics. Let's just keep this really simple, because what happens is we get so distracted. Oh, should I do this? Should I do that? Should I do that? And you know what ends up happening? We do nothing.
Right.
We do nothing.
Right.
So that's why I'm like, okay, vegetables, fruits, water, whole grains, eating that consistently, taking inventory of how your body is responding to certain foods, right? Making sure that you are, feeling energized and not energy depleting, so that you can perform the physical activities or the movements that can help you sustain that energy long term.
So taking it kind of up a level, are there, I don't know, blood tests or any other type of tests that could kind of help someone like you to know exactly kind of the things that help my body to prosper? Because I would guess that, I mean, is it fair to say that my body probably, quote, wants certain nutrients more than your body does, or my body doesn't want some?
Yeah, of course. So usually we do just a complete blood count, which is looking at all the cell lines on your body, so you can tell if someone's anemic or maybe lacking iron stores, or in an elderly person, or older person, maybe there's maybe a blood loss coming from somewhere. So we can find that in a complete blood count. Also, there's a basic metabolic profile that allows us to assess the function of the kidneys and also the liver. And there's also, we do the cholesterol levels to check to see what your cholesterol is, and an A1C as well. And that is to check to see if there's any evidence of diabetes. And I will often check a urine test as well, because some people may have kidney problems, and we can see evidence of that in the urine. And vitamin D levels as well, because depending on where you live, if you're in an area that does not have a lot of sunlight, you can be low in vitamin D. So those are some of the blood tests that we do on like a regular primary care visit, to see what is gives us like just an assessment. Hey, what's going on in the body? And then occasionally, depending on a person's symptoms, let's say they're saying, "Oh, I'm just so tired, just feeling really fatigued." I'll also check a thyroid hormone as well, because thyroid can also affect our mood.
Perfect. That's very interesting. And again, another mirror. If you were one of my clients, I would do some checkups as well. We would look at your numbers, your financial numbers, and that would tell us where some changes need to be made, and where there are opportunities, and it would also tell us where some of your strengths might be. So how does your practice differ from the quote typical quote doctor's office? What is the difference between you and the quote just the primary care doc?
Yeah, so I kind of have like two practice. So I have like my doctor job,
okay.
And I have two specialties. I have my primary care, I work as a primary care physician, and also sports medicine. So, but I still incorporate a lot of the techniques that I've spoken about. So sometimes though, I don't have enough time to assess all the mindset stuff, right?
Mm-hmm.
And I have to be mindful of that and schedule more frequent visits. Let's say if it's a person who's like really struggling, with
mm-hmm.
their weight and diet, I may have to schedule more frequent visits so I can really attend to that person, right? Then I have my coaching job, and that is where I have way more free range, because I'm now able to assess all the mindset things that are in the way, in addition to helping that patient diligently create goals that really is to create goals that really is in alignment with their lifestyle, right? Because
mm-hmm.
I'm not like, hey, do these exercises, eat this, but I have to be mindful of, okay, well, what time do they go to work, and what is their energy like at certain parts of the day, and do they have support? Like, do they even have support structures in place that can allow them to make this change? So in that setting, I have way more free range. I have way more time to really just get to the meat of
now,
where,
is this
like,
in a virtual setting or
in a virtual setting?
Perfect. Yeah. So there's no boundaries, no distance issues. So I love that. And that's a beautiful thing of technology. I have a great primary care doctor, really nice guy. I feel like he cares for me, and I actually ask questions. I care about my health, but I could imagine that in certain cases, just the typical primary care scenario, you don't have time to really delve into, hey, I noticed your liver numbers, so you're drinking too much. Stop drinking. Well, obviously, duh, right? But there's probably some other, why should you stop drinking? What's causing, what are the stressors triggering you to, and that's where maybe that coaching relationship could really help get to the bottom of what's causing you to drink, not just, I don't think anybody thinks that drinking's healthy, but maybe, and there's probably 100 other habits that are unhealthy, that if you can get to the root of why that habit is happening, then you solve the problem, or solve a bigger part of the medical issue that it's causing. So
yeah, for sure.
All right. So if somebody is thinking, I want to take my health to the next level, And I would like to have a coaching relationship with a board certified physician because I know my health is important, and I know there may be some things that I need to get past. How do they contact you, and what does that process look like to even see if you and they are a good fit, and if it might make sense to work together?
Yeah, so they would go to my Instagram page, and I have a bio there, and you would click the link that is associated with that's on my bio, and in that link you'll see a list of other different links, but you're going to click on one-on-one 30-minute discovery call. And on that discovery call, we'll just discuss what you tried before, what worked, what didn't work, and see like what your vision is. What is your wellness vision for your life?
And that's interesting, wellness vision, because in most cases, doctor's visits are fix me, make me better, as opposed to help me to be well,
Yeah.
so I don't need someone to make me better. And obviously illnesses are always going to happen. But just like preventable money problems, we like to help our clients to prevent. I'm sure one of your bigger goals is to help your clients or your patients to prevent the preventable health issues that are all there, for sure.
For sure.
So perfect. No, I love that. And this is just a fascinating episode for me, because I've always believed in health, and I've had people close to me with some health issues, and they always say we're all going to die at some point, but there are just some chronic illnesses that are just very unpleasant ways to be sick, and they're, quite honestly, they're horrible. I mean, a lot of the smoking related illnesses are just, they're ugly and horrible and painful, and if you can not go through that, you want to not go through that. For sure.
And I just want to say I rebuke that statement, because I truly believe that we can live lives that we're proud of, that we can evolve into the highest version of ourselves while we're alive.
Sure. Mm-hmm. Yep. Absolutely. No question. So I'm going to ask you the last question that I didn't tell you that I was going to ask you, but I ask every guest for their definition of true wealth. So what is Dr. J's definition of true wealth?
Yeah, I think true wealth means that you live in alignment with your values.
Explain that. What does that mean?
Yeah. Just like in society and in general, we kind of do what other people expect us to do. So it's just like, okay, I'm going to go to school, get a job, and that's it, right? But I encourage us to aspire for more, right? It's like I mentioned earlier, it's evolving into that best version of yourself. Like, we've never just arrived. There's always room to grow and expand and become that highest version of ourselves. And I think it starts by identifying what we value and living in alignment with it. So for me, one of my values is integrity. And for me to act in integrity, that means I need to practice what I preach. Another one of my values is just standing up for what I believe in. So being on this journey as a physician, I knew that I wanted to impact healthcare in a different way. And I was scared initially to take that plunge because I thought I was going to be seen as different. But along the way, I thought to myself, okay, well, I need to live in alignment with what I believe. And I believe that health is all encompassing, right? It involves our mind, it involves our body. And, there's some doctors, that don't talk much about it. And there are other doctors who do talk about it. And I think this is the movement of, healthcare, is actually standing up for how you think the trajectory of healthcare should go. Because if we stay quiet, then more people become sicker and more people will die. But if we come out and really live in alignment, like, okay, this is unacceptable and I'm going to do something about it, then that's how you live into that highest version of yourself.
It's really interesting how your demeanor and even the tone of your voice just changed. I mean, how the passion of what you're talking about. I mean, I love that.
I'm so passionate about it, David, if you haven't noticed.
No, that's great. Now, I'm just curious, have you gotten any pushback from the quote traditional medical community? Maybe that the coaching part is I don't know, not real medicine or anything like that, or have you gotten support?
No, actually. So what happened was, I felt scared to like come out and,
Yeah, yeah.
talk about this stuff. So
Hmm.
what I did, I started finding other doctors who were talking about things like this. And now I have a community. So I'm not living in isolation. And I think just anything, it's so important to be part of a community and be amongst other people who think and who think like you, because that is how we all empower each other. So whether it's you starting a new fitness program or whatever, any new routine or new habit, it's so important to be a part of a like-minded community, because that's going to lift you up. That is what's going to help you live in alignment with what you say you believe.
Yep, absolutely. No question whatsoever. I love what you're doing. And I think health is just such a neglected part of a lot of our lives. And it needs to not be, because it's something that we have some control over. And yeah, our habits are just insanely important. So for anybody who is interested, go to we'll put it in the show notes, but medfitdo on Instagram. Check out Dr. J. Schedule that one-on-one call. I mean, shoot, just to have a 15, 20, 30-minute conversation with a passionate physician. I mean, that's a priceless conversation there. So I would encourage anybody to do that. That seems like a great idea. Let's all take care of what we can control within our health, within our money, within our relationships, within our spirituality. And let's live, like you say, the best versions of ourselves, because that's really what it comes down to. So really appreciate your time. And until next week, we wish everybody a blessed holiday. All right.